The question you were dreading, BPH drugs, dutasteride and finasteride, that can shrink the prostate.
Yeah.
We say, you could say 20, 30%, that can change your PSA. What do you do with these guys on active surveillance? Because there was a time when we thought this might help. Some people still think it might. What do you do with these drugs that can cloud the picture? How's that?
Yep. Well, first of all, we've got a trial. The REDEEM trial showed that using dutasteride reduced the likelihood of progressing to treatment by about 25%, mostly because it drops the PSA and helps with the anxiety. We will mentally double the PSA for men on surveillance, but these drugs are great in that they will drop the PSA. They also stabilize the PSA. So rising PSA on one of these pills, finasteride or dutasteride, is a much more consistent sign of a progressive cancer than a rising PSA for somebody who is not on one of these medications.
That's interesting.
So that's the first point. They sort of fell out of favor because of this whole business with the FDA. It was found in the early trials, and you're shaking your head because you like I do, this is ridiculous. When men go on these medications, we find more high-grade disease. And there was all this controversy. Are they actually driving the cancer to be higher grade? Obviously, it's not. And there have been tons of analyses showing pretty clearly all we're doing is diagnosing high-grade disease more consistently, because finding the high-grade cancer, especially in the pre-imaging era, you're looking for a needle in a haystack. Well, if you make the haystack smaller, you're more likely to find that needle with the same number of biopsy cores.
Well put.
So despite that clear logic, there is still this black box warning on the drugs about driving high-grade disease. So they're not used often. I personally use them for men who have low-grade cancer plus BPH, and they're not heading for surgery, but also have a lot of symptoms, or men where the PSA is just really high and we don't have a good explanation for it. The prostate's not that enormous, but we've done 2 biopsies. Both of them show 2 cores of 3.3. But the PSA is 18 and stays up there. I've had a few men like that who we put on finasteride and it falls by like 80%.
Wow.
And I can't explain it, but everybody feels better when the PSA is lower, and they have few side effects. 5% roughly will have sexual side effects. Can make your hair a little thicker. This is the same stuff that's in Propecia.
Yeah.
And I think they're probably underused, quite honestly.
That's really interesting, your opinion on that. It's nice to hear. So we're talking about finasteride, which was known as Proscar, dutasteride, which is known as Avodart.
Yeah.
So you should have a discussion. I mean, I don't downplay the side effects from them, but at the same time, there is this kind of thinking that if a drug's been out there for 20 years, you got to find every possible thing that's wrong with it and scare people. But obviously some people don't do well with it. Some people do. So at least it's a part of active surveillance. So your tangible point is, if you're on any of these drugs, and including the hair drug, how about that? And the PSA starts to go up, that might be telling you that the disease is in progression, right? Yes. That's a really strong point.
And actually, to emphasize the point about Propecia, about the hair drug, men tend not to report this on their medication lists. When you tell your doctor what medications you're taking, men tend not to report Propecia, and it absolutely counts. So Propecia is a 1 milligram finasteride, as opposed to the 5 milligram finasteride, the Proscar that we use for BPH. But even the 1 milligram can drop your PSA. And there was a nice study out of the VA a couple of years ago, because primary care docs still think about the 4.0 threshold. They were not referring men for evaluation who had a PSA even like 3.8, 3.9 on finasteride. So by the time they cross the threshold, it's really like an 8. So there were actually higher death rates for men on finasteride in the VA than men not on finasteride because of delayed diagnosis. So very important to report this to your docs.